1 in 5 children and adolescents may have a diagnosable mental health disorder. More than 27% of Tennessee youth feel so sad or hopeless they stop doing some routine activities. Only half of the youth with mental disorders receive professional services. More than 50% of students age 14 and older with a mental disorder drop out of school. What do our children need to be mentally healthy?
Major funding for NPT Reports, Children's Health Crisis, is provided by the Healthways Foundation, addressing the critical issues of children's health and public education, the Nashville Healthcare Council, the Monroe Carroll Jr. Children's Hospital at Vanderbilt, where discovery brings hope, Vanderbilt University School of Medicine, Department of Pediatrics, Baptist Healing Trust, fostering access to compassionate healthcare in Middle Tennessee. Additional support provided by the Orrin H. Ingram Fund and by members of NPT. Thank you.
Hello, I'm Kimberly Williams Paisley. We know that children must eat well, be physically active, and live in a safe environment to become healthy, productive adults. But mental wellness is just as important to a child's overall health. What does it mean to be mentally healthy? What does it look like when a child is experiencing social and emotional problems? And what can we do as parents and as a community to help our children overcome these issues? Join me as we explore the answers to these questions in this edition of NPT Reports, Children's Health Crisis.
As a young child, Jerron Moore knew he was different than his peers.
When I was in 3rd, 4th grade at late elementary school, I'd say I was full of everything. When I say that, I mean full of life, full of energy, maybe full of crap. I was a little bit more than everybody else. Like most people would take something to this level, I would, take it way over there. Maybe it didn't necessarily need to go that far, but that's just who I was.
Mental health affects us from a very young age, and we should pay attention to it from a very young age. Very young children, they start looking to express themselves appropriately, to understand the feelings that they're having and what does that mean and what do I do with it, all the way up through each time they hit those developmental levels.
Children who are mentally healthy don't have serious behavior problems. They are emotionally stable. They're able to manage their own behavior, to react appropriately when they encounter circumstances that would be disturbing, but they can respond appropriately.
Being a healthy child really means that you're able to make friends, that you're able to go to school, that you're able to learn what's being taught, that you're also able to interact. And most importantly, as you do each of those things, can you internalize those things to really think well about yourself, to believe that you can do things and that you can really accomplish the things that are in your future. When we talk about mental health problems, what it really means is, when are you not able to do these things?
Jerron's abundant energy frequently got him into trouble at home and at school. He struggled to feel good about himself.
I really had no self-esteem, I was kind of fat back then, I just felt like I didn't fit in anywhere. I had bullies, I had bullies for a little while, and I got picked on a lot, and then it just came to a point to where I was like, I don't want to be picked on anymore, so I just decided, well, I'm gonna fight back, and then that just opened up even more trouble because I started beating people up.
People seem to understand mental health better if you talk about what it looks like. And that's the emotional and the behavioral, because that's how children exhibit mental health problems. In kids, you're going to see more acting out behavior, reacting extremely to something, non-compliance with rules, difficulty learning, which leads to frustration, and so you have, temper tantrums and angry outbursts.
Mental health problems are not limited to those who are interacting with others in inappropriate ways. They can also include the way they're dealing with themselves. That can result in depression, can result in suicide thoughts, and other kinds of self-injurious behaviors.
Jerron's behavior at home and school continued to deteriorate until it reached a crisis point.
I was in so much trouble, so during recess, I never really got to play. I was always the guy sitting there watching everybody else play with the teachers, just sitting there, So I wrote a suicide letter, and I don't know, I don't even want to talk about that. It was crazy. I just felt like nobody really cared about me, but I was wrong. My mom cared, my grandma cared, my family cared.
After the suicide attempt, Jerron's mother immediately sought help for him.
I got a therapist, and it helped a lot. Basically, what he helped me do was to look myself in the mirror and be okay with what I saw. Just be like, all right, this is who I am, and can't nobody else be me. I got to deal with it, and hey, So this is who I am, So after that, my depression issue, it faded, and I really just didn't feel any need to be depressed, because I'm okay with myself now.
Jerron eventually received an official diagnosis, attention deficit hyperactivity disorder, or ADHD.
I didn't understand it for a while. I just knew that it meant that I was really hyper and impulsive and that kind of thing. And as I got a little bit older, I understood it a little bit better. And as I took the medication, my focus level picked up, and I was able to sit in class and do my work.
Jerron was fortunate to have his mental health issues diagnosed at a young age. His struggles are not unique.
Mental health issues are very prevalent, not just in Tennessee, but across the nation. And I think some of our estimates are probably low, but generally a lot of people think as many as 20%, 25% of children have mental health issues. I view mental health as a continuum all the way from simple adjustment kinds of issues to the more serious major mental illnesses that we find are presenting themselves now with children.
Children's mental health problems cover a very wide range, from those who are fearful, who have some minor levels of depression or other kinds of behavioral challenges, to those who have very, very serious emotional disorders that really inhibit their ability to function appropriately in their family, in their school, and in their community. We have children who wind up in psychiatric hospitals, and children who just need early intervention to help them learn to behave appropriately.
Mental health disorders don't discriminate. There are risk factors that make more children susceptible to develop a mental health disorder, but in general, it doesn't discriminate.
The risk of developing a mental health disorder begins as early as conception.
When the child is conceived, you have a couple of things that interplay. You really have the genetic histories of both of the parents, and really what problems did they have. Aside from those genetic influences, you really have what happens when the mother is pregnant. And so this is, was the mom drinking while she was pregnant? Was she smoking tobacco products? When you combine the genetic influences plus things that have happened even before the child was born, a number of those factors will also affect how the brain will develop for that child. When your brain is structured differently and doesn't function quite as well, what you'll find is that your thoughts are different, how you interact with the world around you is going to be different.
Look at our play set over here.
A child's environment also plays a key role in mental well-being.
Be careful, as it leans.
For Lori Plemons' children, the environment turned devastating in May 2010 when floodwaters inundated their community.
Before the flood, Avery was very just happy-go-lucky, your typical 6-year-old. As a child, your home, your school, and both sets of grandparents' house are your places where you are safe. So basically on May 2nd, she lost 3 of those 4 safe places. Right after the flood, when she got to my mother's house, she kind of withdrew and went off and cried for a little while, my mom said, and then started sucking her thumb. Anytime someone would talk to her, she had her thumb in her and had never done that before.
Even after the floodwaters receded, Lori's children had to deal with a life quite different than before.
I mean, our life has been in total upheaval for a whole year.
Let's get the game started.
With Avery, she showed a lot of signs of stress and anxiety. She could sense that I was really on edge. Her father was on edge. We were both tense with each other. Her grades at school this year have been terrible. And that's not like her at all. I mean, before BF, before flood, she had made wonderful grades and, was a great reader, really focused and involved in school. She has totally changed. Has also been a little, I say more defiant a little bit, and can be angry.
Stress is a part of everyone's development and everyone's life. And in fact, inoculation of stress is important for our development. But if we think of an inverted U-curve shape, that benefit of stress is up to a point. After that point, the effect appears to be detrimental, being what we call traumatic stress, a type of traumatic stress that really has a cost for the psychological and physical well-being of the individual.
Traumatic stress in children can result from a range of environmental factors beyond one-time events.
If they live in a family where they experience domestic violence and constant battling between their parents or abuse of their parents, then that's going to be very traumatic for them. Trauma also occurs when they themselves are abused or neglected, when they live in circumstances of extreme poverty, and it's very traumatic to not be sure they're going to have enough to eat. But the neighborhoods where it's not safe for them to go outside because of the level of violence and crime in the neighborhood, then those are all traumatic experiences that contributes to mental health problems.
If we're going to cross the street and there's a truck coming at us, we want cortisol to kick in and adrenaline so that we can jump and get out of that dangerous situation. However, when a child feels that all day long, every day, for many years, a truck is coming at them, the hypersensitized system secretes more cortisol than is necessary. And that extra cortisol can actually have some neurotoxic effects. Some of our pilot data is indicating for the first time in humans that cortisol actually may be damaging the hippocampus during development.
If you fail in your attempt, are you probably going to spend some time?
Kids, when they're in this state, have difficulty retaining information as well as learning new information. So if you grow up in this environment, it's also going to be a lot harder for you to do well in school, but also to learn basic life skills that you learn even outside the classroom.
In Tennessee, we know that there are very high percentages of children, especially those who are 13 plus, who are in state custody, who have mental health issues. And that runs about 88% of children who are adjudicated delinquent. For children, though, who are dependent neglected, it's about 70-something%. The high prevalence of mental health problems among children who are in the child welfare and juvenile justice system is is often attributable to the environmental factors, the life experiences they've had.
Sarah Baker spends most of her workday out of the office.
The typical day in a youth villages specialist involves us being in the car a lot. You can see a lot of behaviors at home that you're not going to see in public, and so that's the best place to meet and to really see what is actually going on. Most of the issues that we see are physical aggression. We see a lot of defiance where children aren't following directions, inappropriate sexual behavior, problem school behaviors, self-harming behaviors, or suicidal behaviors. Those are the big things that we see.
When Alicia Brown first started working with Sarah, her son's behaviors were spiraling out of control.
I was really frustrated. I found myself yelling a lot. He would do things like with his sister, he would get real frustrated and yell and scream and hit sometimes. I was noticing that at school he would get in trouble a lot, and he started not to do his work. For some reason, he just decided this year he wasn't going to do it. So I found myself crying a lot, breaking down, just really, really frustrated and overwhelmed, and to the point I felt like I wanted to give up.
You are the caregiver 24/7. If you have a child who has some severe behavioral problems, that's exhausting. It affects marriages. It affects siblings, because one child may get more attention simply because of those behaviors and those needs than a child who may not have that. So the impact is pretty significant.
Treatment does work for children. We know that. Treatment works in general. But part of it is what really is important is identifying exactly what the problems are and being sure that just because a child ends up the first time they present their problems in juvenile court doesn't necessarily mean it's a criminal justice issue. It may have something to do with learning deficits. It may have something to do with a dysfunctional family situation.
Kids are very resilient, and they actually have this ability to almost retrain themselves. People have actually done studies, and they've been able to show that if you use therapies, such as cognitive behavioral therapy, you can actually get the correct brain regions to light up, which means that kids who have been through traumatic situations will actually start using the right pathways that normal kids are using in terms of how they think about things.
All right, so what we're going to do today is a relaxation technique.
Sarah Baker worked with Alicia and her children to develop specific skills and tools to help diffuse and manage Reggie's behavior.
My house is totally different. I enjoy my children now, and I could not say that before. And it's just calmer. His anger issues, he's got a hold of that. He still gets frustrated, but he knows to go to his room and de-escalate, and I'm proud of him as far as at school as well. It's just a turnaround, 100% turnaround at school. So he actually wants to do his work.
It's really exciting to come in and see a family really struggling, and then after a short period of time, I mean, you know, within the first 4 weeks, you already are starting to see, you know, typically some pretty drastic changes, and the family interactions are so much better. They're communicating better. They like each other more, and it's really exciting as a counselor to see that.
For all practical purposes, we're here to discuss issues and concerns that...
We know that there are some things that are most effective with certain diagnoses. We know that about medications, but the way in which a child is approached, how an intervention is implemented, makes a world of difference if you look at that child as an individual.
So is that something that you and your brother think y'all would like to do? Yeah.
The most effective treatment is really approaching it in a family-driven fashion, where it's a collaboration between parents and providers.
Mental health treatments are more effective than the treatment for blood pressure control or for cancer. There's no reason why you shouldn't get treated.
In 2009, Naomi Alonzo had to quickly find treatment options for her teenage daughter. April Alonzo was suffering severe depression from bipolar disorder.
She was in bed about 20 hours a day. She wouldn't even come down to eat. She couldn't even go to the bathroom. She just was laying in bed for hours and hours.
So we went online and we were looking for a day treatment program for her, and there aren't any day treatment programs for teenagers in Nashville, and so that made that very difficult. But we did find a program at Vanderbilt, and when I called, they said it would be about 60 days before we could get an appointment. And so we also knew that wouldn't work, but we got lucky. They had a cancellation, and so April was actually able to go the next week.
One of the biggest problems we have right now is really finding trained professionals. There is a shortage of professionals in the mental health field generally, and people, particularly child psychiatrists, board-certified psychiatrists, are very difficult to find.
What we have available are the most intensive treatments, like coming into a hospital, and what we have available are the least intensive treatments, like go to a park and play. What we're missing is really a lot of the in-between stuff.
Well, I think this is pretty good. Is there...
I know, having worked in other states, that there are many other levels of care that are available. There are lots of things that we would really call kind of the safety net of services, or basically wraparound services, that just aren't available here. Or if they're available in such short supply that you can only get 10 kids into it, but the need is maybe 1,000 or 10,000.
There's a huge unmet need, and I'm not sure that we'll ever have all the resources. Well, I know we won't. We'll never have all the resources that I would like for us to have to address all those things. I think all we can do is try to prioritize those needs, identify as many resources as we can, and help each child one at a time, each family one at a time.
Currently we have more of a fragmented system for children's mental health, and different systems don't talk with each other. So in moving forward, and there's movement toward this, having a more streamlined system where people share information so families don't have to tell their stories over and over again to a new person each time they enter a new service.
And welcome to the Child and Family Team Meeting.
Building collaborative teams with families so that the family has one plan to follow, as opposed to a plan at school, a plan at the therapist office, a plan from their probation officer. And those may contradict. And so the parent is not sure which one to follow, but wants to do the right thing.
Tennessee has been in the forefront of testing a more collaborative approach to mental health care called System of Care. When Jerron Moore started having serious problems again in high school, his mother approached Muletown Family Network for help. Muletown is one of 5 Systems of Care pilot projects in the state.
The way things are different here is the child and the family has a voice. We ask them what's worked in the past, what hasn't worked. And then we also try to get all the agencies together so that the family doesn't have to go to multiple meetings. If they're having problems in school and having problems at home too, we try to work where we all meet in one location.
At first I didn't know if it was gonna work or not. I was like, man, these people ain't gonna come. And they came, They wanted some change. They wanted things to be better than what they were, so they made me feel like I had to give extra effort just to, to hold up my end of the bargain.
Is there anything that you'd like to talk about right now? Anything you guys want to get out?
Jerron held up his end, joining Muletown's youth group to help raise awareness about mental health issues in children and setting attainable goals.
One of my goals was to get a job. The other one was to get my license. And my long-term goal was to go to college. I can proudly say that I accomplished every one of those goals.
In Tennessee, we've recognized the value of system of care. We have begun some processes that are laying a foundation for better communication, better understanding, but it really will take more. And one of the big challenges is there are not clear funding streams to pay for coordination. It takes work and commitment and time, and we have to figure out ways to ensure we pay for that coordination that we know makes such a difference in improving outcomes.
How many of you have ever heard that term mental health before? A few people have. You know what? For a lot of people, they've never heard it, so it's okay if it's new to you.
At Edmondson Elementary, 4th graders are learning the importance of brain health.
So many kids, mental health is a new term for them, so they don't not sure what it is, or they have a negative perception or stereotype of mental health or mental illness. And so the goal really is to erase the stigma, is to help dispel some of those myths, to break down here's what is true, here's what's not really true, and sort of introduce mental health and then what you can do that affects your own mental health and how you can stay mentally healthy.
Let me see you get down.
One of the biggest challenges in addressing children's mental health needs is the concern about the stigma of mental health and the reluctance on the part of parents and family members to really acknowledge when there is a problem that is beyond what they can manage and when they need help.
We say my medication is 25% and the hard work I have to do is 75% because I have to fight my brain. My brain is telling me like, oh, I can't get out of bed. I just can't do anything. But I have to say, you know what, for the best, I have to get out of bed. I have to go do work and I have to get out. And I mean, when you're fighting your brain, you have to learn these skills that'll help you understand, you know, what your brain is telling you is wrong. And I just hope people will realize that, you know, you can't see it, but it's agony and we're working our hardest to get better.
There are real neurochemical things going on in the brain. There are real reasons why people aren't able to do the things that they want to do. Having kids come into our hospital and really being able to get better, get well, to understand what's going on, but to also see a dramatic difference in a short period of time, it also really proves to them how real their illness is and basically how effective the treatment can be.
I like this one.
I'm not ashamed of her diagnosis, but we share with some people and then you can tell the next time when they don't want to know any more about, you know, so they just won't ask how April is because I think it's scary. And so I think the choice that they're making is not to make that part of their life or their understanding, and that's okay. But it's difficult, it's hard, because it hurts my daughter.
I would love nothing more than to not have kids to treat in the hospital. Most kids don't need to come and see me. What they need is a wonderful, loving household. What they need is a wonderful environment around the kid that has other support systems in place.
We know what the problems are and we know what works, but ultimately the biggest challenge for us is the lack of resources to really fund the things that we know work.
What we all want is our children to grow up and be successful. This is a big part of it. You have to address mental health if you want successful children.
Every parent hopes their child has the emotional strength to weather the ups and downs of life with ease. But the reality is that we never know whose child will need help or when they will need it. As a community, we have to address our children's mental well-being. If they do not feel safe, nurtured, and supported, they are much less likely to succeed in school, become good parents, productive employees, and good citizens, all important elements for the future prosperity of our community. Please join me in learning more about the children's health crisis in Tennessee and what you can do about it by tuning into NPT's ongoing coverage and by going to wnpt.org/children's health. Thanks for joining us.
Major funding for NPT Reports, Children's Health Crisis, has been provided by the Healthways Foundation, addressing the critical issues of children's health and public education, the Nashville Healthcare Council, the Monroe Carroll Jr. Children's Hospital at Vanderbilt, where discovery brings hope, Vanderbilt University School of Medicine, Department of Pediatrics. Baptist Healing Trust, fostering access to compassionate healthcare in Middle Tennessee. Additional support provided by the Orrin H. Ingram Fund and by members of NPT. Thank you.